We will first go through some theoretical aspects. Then we'll go to computer lab. There you will be using this PowerPoint applications, and you will be learning how to prepare a presentation. A PowerPoint presentation application, it was developed in 1986 in USA by some software engineers, and they sold it to Macintosh. So it was the property of Macintosh. Ultimately, Macintosh could not retain it. They had to sell it to Microsoft company. So at present, from then till now, it is the property of Microsoft. And Microsoft developed some versions for Mac computers. In those who are having Mac, they can also install the Android one. However, usually I know very less number of students having Mac. So we will use the version used by other platform. Why we use, what is the purpose of creating this PowerPoint? What is the purpose? Making presentations, making lectures. Through the lectures, the lecturer, the presenter wants to give you certain informations, knowledge. Okay? Previously, what we actually used to do, we used to do blackboards, flip charts. Okay? So this is very difficult to make a presentation, a lecture within a stipulated time. Lot of informations cannot be given. But nowadays, with the help of this, we can provide you lot of informations within a short span. Suppose you will be presenting a research. Definitely, we will be conducting some research. So you have to present through this presentation why you have done the project, the research, the background of the research, the rationale of the research, means the purpose. What is the essentiality? When research is done, when we find there is lack of knowledge, there is a lacuna in knowledge. So, researcher wants to find out the answer to those lacunas. Okay? Simply, suppose throughout the world, even in our country, rate of mortality of preschool children is very high. is very high. Why? Because of malnourishment, unhygienic conditions. The unhygienic condition, lack of nourishment, make them vulnerable to diseases. As a result, they die. So that's why here the rate of mortality is very high. In India, as a whole, the mortality among preschool children is known. Prevalence of, you must be knowing what is prevalence. Prevalence of particularly say for example, nutritional disorders. What are the, can you give some examples of nutritional disorders? Any? Marasmus or kwashiorkor or rickets, vitamin A deficiency, scurvy, very, so many things. We, present days, we want to find out the vulnerable groups of these children who can suffer these diseases. So what is done? Researchers conduct surveys. For example, I want to know the picture of undernourishment in Tripura, where this problem, undernourishment problem in preschool children, where it will be high, either in the rural area or in the urban area. Where? In rural area. In urban area, it is not that much. It is there, but it is not that much. What is the reason? In rural area, the prevalence of undernourishment is high. What may be the reason? Level of education, number one. If they are having low level of education, some are not having any education, formal education. So, how they would be knowing which food they are to take, which food contains more proteins, which food contains more vitamin A, they don't know. As a result, they couldn't select the appropriate food for their children. So, ignorance about the nutritious food, one of the main reasons. Another reason, important reason, economic condition. Another reason is economic condition. Some are daily laborer, some work in agricultural fields. So their earn is less. So they cannot spend much money for food. So economic status is very important. Availability of food. Here in Agartala, which food you want? Everything you will get. In rural area, no, you won't get. So, the proper food, non-availability of food is there. They used to consume more mostly carbohydrate foods, less proteins. Just think what they would be eating: dal, bhat, siddho, rice, almost fully carbohydrate. Only 2% protein is there. If you take 100 gram of rice, only 2% of protein you will get out of that. Only protein source is lentil, musur dal. It is having good amount of protein, near about 8 to 9 gram percent. But these proteins are not a good quality protein. Proteins to protein, then good quality, bad quality. Proteins are classified according to the source: animal protein, plant protein. Today I am having lot of time, no? So 2 hours. No? That's why I will be spending. Vegetable, plant protein and animal protein. We know proteins are made up of amino acids. How many amino acids are there? 20. And they are classified into 2 depending on their essentiality in our body. What are these? Essential amino acids and non-essential amino acids. Why some proteins are there are 8 amino acids? They are very essential. Why they are essential? Our body cannot synthesize it. And for this purpose, we have to depend on other source. Other source from a plant source or a source from other animals. Okay? So, only for this purpose, we are killing animals. We are eating different kind of cereals. Pulses, rich protein source, vegetable protein is pulse. Soybean also comes under this category. Okay? In village, they will only purchase lentil. Other pulses are costly. So they will depend on this. And they are eating boiled potatoes, colocasia, kochu. These things, some vegetables. Where in these vegetables, green vegetables, we classify vegetables into 2. Potato, is it a vegetable? Yes or no? We eat different group of foods. Number 1, cereals. It may be rice, it may be wheat. So cereals. So this is one category. Next category is roots and tubers. Potato comes under this. Carrot comes under this. Radish come under this category. So second category is roots and tubers. And third category, vegetables. There are 2 types: green vegetables and other vegetables. Green vegetables, you know the examples of green vegetables? And other vegetables, those who are non-green, brinjal, gourd. So there are other vegetables. And beside this category, and beside this, there are groups of food. They will provide protein, and these are flesh, fish, meat, poultry, egg, milk that you don't like. Milk. So these are the sources of, they will provide mainly proteins to our body. That's why we take it, and these are costly food. These are costly food. What other foods we take? Fats and oils. Be it butter, be it ghee, be it oil. So these are fats and oils. We also take sugar. We also take sugar. We also take nuts. Sugar, this will provide only carbohydrate, only glucose, means energy source. Cereals, mainly they will provide energy. Radish, roots and tubers, they will provide, because they are mainly carbohydrate, starch. Okay, they will provide energy. Oil, what they will provide to us? Fats, oils. What they will provide? 1 gram of fat provides how many calories? Calorie equivalent of fat. My goodness. I have to go there. Yes, 9 kilocalorie. 9 kilocalorie. That means it provides energy. 1 gram of carbohydrate provides 4 kilocalorie. 1 gram of protein provides 4 kilocalorie. And so these are energy equivalents of these foods. All these categories of foods are actually classified in 3 groups. One group will provide protein, which will help us in our growth, for growth, maintenance. When we will cut our skin, so after some days it is repaired. So this repairing is done by the proteins. They produce in our body various functional proteins. Hemoglobin, globin part of hemoglobin. Rhodopsin, iodopsin, opsin part is protein. The enzymes are protein in nature. Most of the hormones are protein in nature. Our cell membrane, our protoplasm, cytoplasm, we will get the protein. Without protein, we cannot grow. Besides, providing energy is their secondary function. It is their secondary function, not to provide energy, but if it is needed, they will provide. And when this protein will provide energy to your body, you will lose weight. Because your body proteins are broken down. If you undergo 8 days, 9 days fasting, what will happen to your body? You will lose weight. Because the tissues will be wasted. Okay. So they promote growth and other functions. Protein has a lot of functions. In biochemistry, they will be teaching you. And another group is, so who will provide, who are the group among these? Milk, meat, fish, egg. So these they will provide these protein, important constituent, important nutrients. Another group will provide energy. Fats oil, nuts, so, what is this? Seed from that oil is produced. Hmm? Mustard. Hmm? So, they will provide energy. Though they have got in our body so many functions. The fat produces the cell membrane. The protein bilipid layer, they are made up of this only. Hmm? So, they have got other functions. Cholesterol comes under this category. Cholesterol is bad, no? Always bad. Good also. Example, doing good in our body, cholesterol. Hmm? Anybody? Yes. Yes. Fluidity of the cell membrane. The amount of cholesterol, if is more, there it will be more fluidity. Okay, very important. The mainly body cholesterol is used for making very, very important hormones, steroid hormones. What are the different steroid hormones? The hormones produced, all the hormones produced by adrenal cortex. Adrenal cortex produce three group of hormones. Cortex has three definite layers. And these layers produce three group of hormones. Glucocorticoids, mineralocorticoids, and sex corticoids. And they are produced from the backbone of cholesterol. Even testicular hormones, ovarian hormones, steroid hormones, testosterone, androgen. Same. They are steroid hormones. Estrogen, progesterone. They are so very important. Cholesterol is very important also. Why they are bad? When the blood concentration of cholesterol is high, what happens? Hmm? Why they are bad? Bad cholesterol, LDL cholesterol, very low density cholesterol. Why they are bad? Because they, when their concentration is high, they promote atherosclerosis. What is this? Deposition of fat in the innermost layer of blood vessel. Innermost layer means endothelium. The endothelial cells, these fats are deposited in the endothelial cells. So, endothelial cells will grow, increase in size, they will increase in size. So, blood vessels, they are having 3 layers. If you cut, either it is a vein or an artery. If you make it a cross section, remain fit tomorrow morning. Okay. Good. Hello, hello, hello. What was the reference? Cholesterol. So they are having 3 layers. Second layer is a smooth muscle layer. Their function is they are having longitudinal fibers and circular fibers. Because of this fiber, when they are contracted, the blood vessel is constricted. Length is reduced. So as a result, what happens? There will be resistance to blood flow. Lumen is constricted. So blood will not be flowing easily. So resistance is developed when these muscles are contracted. So these muscles are contracted, relaxed by our nervous system. As a result, our pressure is increased. When they are dilated, our blood pressure is decreased. Okay. The innermost layer, they are very smooth. They are very smooth. Single layer of epithelium lines. Okay? Single layer, one, they are joined together this way. So if they deposit the fatty compound, some cells will increase in size. So in which direction they will expand? Towards the lumen or towards outside? Towards the lumen. As a result, lumen will be narrower. And it will not be smooth. This will be rough. But our blood cells, when flowing through this, the problem is with platelets. They are very fragile. If there is any surface, rough surface, they used to, when they come in contact with this, they used to get ruptured. And when they are ruptured, coagulation begins. So clot will be formed. The lumen will be choked. It happens in our heart. Our heart, wall of the heart is having, see, heart is dealing with blood, lot of blood in its cavity, but directly it cannot use this blood. All the tissues of the wall, they are getting their own nutrition, etc. through their own vascular system, coronary circulation. If this atherosclerosis happens in the coronary blood vessels, then what will happen? This, say one vessel, left bundle, one vessel. It is supplying left ventricle. A portion of the left ventricle. One branch is supplying a portion of the left ventricle. So when this is occluded by this, that portion will not get oxygen. When there is scarcity of oxygen, will feel angina, pain. So pain, feeling of angina means there is some blockage and because of lack of supply of oxygen. So when this is completely blocked, then that area will not find any blood supply. So that area will die. That area will die, will not perform its, that area will not perform its function. What will happen? Heart attack. The other area will work, this area will not work, and after some days, say after 72 hours, other area will contract. So there will be, since it has lost its contractility, it will form balloon. Because of internal pressure, it will form balloon, and one time it will rupture. Then the patient will die. Okay. So that's why this way it can create coronary arterial disease. It may happen in brain, cerebral circulation, in the vessels of cerebral circulation. Then what will happen? Stroke. So main culprit is this low density cholesterol. HDL cholesterol are good. They prevent this. They shift the deposited lipids or fats from there to other place. Okay, that's why HDL is good cholesterol. Anyway, so my reference was some foods are providing protein, some foods are providing energy, and some foods are protecting us from various diseases. Say, for example, they are preventing night blindness. Means some are providing immunity to my body, some are providing vitamin C, vitamins. So we know lack of vitamins will produce several problems. So they are protective. See, these vegetables are protective. Not only this, we also should eat vegetables daily. I don't know whether you prefer to eat vegetables, but it has very important functions. What are these? They provide fibers. Two types of fibers, soluble fibers and insoluble fibers. Soluble fibers help easy passage of stool. When there is lack of soluble fibers, then the stool will be hard. You will be suffering constipation. Okay? And the insoluble fibers, their function is to form bulk of the stool. So there should be bulk amount of stool, and at the same time they should be easily moved. So for that purpose we need this, and these fibers are also very important for maintaining health of large intestinal mucosa. Otherwise, thereby they prevent colon cancer. So that's why vegetables are important. It is not a nutritional plus. So the kids, they don't get required amount of foods. As a result, they suffer nutritional deficiency. And this you can assess the children who are suffering from nutritional deficiency. or who are prone to nutritional disorders. So what we do? We measure their height and measure their weight. We measure their mid-upper arm circumference, MUAC. We measure their head circumference. So mainly weight, height and mid-upper arm circumferences are measured. And from these values are compared with data of Indian Council of Medical Research, All India average data, or data given by World Health Organization. They have given percentile data. Okay. So they have given the range. If somebody is having this percentile data below this, then they are undernourished. More less than they will be suffering severely undernourished. In this way, we can classify them, those who are normal weight, having normal weight, who are undernourished, who are severely undernourished or wasted, and we can, by using their height, we also measure long-term undernourishment. Because those who suffer long-term undernourishment, they will become stunted. They will become stunted. Though somebody in respect of age, if height is less, we call the children as stunted children. Okay. So in this way we can categorize. But in city life, in urban area, there the problem is not nutritional deficiency. Problem is overnutrition. It is overnutrition. So, বাচ্চাগুলো গাদ্দা গুদ্দা হ্যাঁ মা আরো খাই না খেলে আমার বাচ্চাটা খায় না So as a result, take more food than it is suggested, than it is required. So they suffer overnutrition, and at one time they will suffer obesity. Obesity has got many problems. Okay, so anyway, I will not discuss that one. We are coming into the main thing, research data. So you are going for a research. I want to see how many children under 5, how many children are undernourished, stunted, wasted, overweight, and studied. So I have studied 1,000 students, say 1,000 students. I have also recorded some other things. You will be visiting families, no? So you will be given a form. What are the informations you have to collect? Their socio-economic conditions, their height, weight, what are the disease at present they are having. So you will get this. And you have to follow this family for 3 months, near about 3 months. 3 months. So you have to see whether any development was there, because you will be suggesting, no? So now they will be having guidance from you. So they should improve. So you have to produce the data and your findings. How you will present these findings? So first you have to collect the collected data, you have to analyze it. You have to make a table. And from this table you have to make a graph. If any data is given, say in first month their weight was this, lot of children, no? Weight was second month, weight was this, third month this, and so on. So it is very difficult to assess from there what has happened. So if you produce from data a chart, it will give you immediately whether weight is increased, whether you first perform the statistics. If I want to know what is the weight of MBBS students of Shantiniketan Medical College, so if you provide me weight of you, weight of her in this way, so it will be difficult for me to assess. So what you will do? You will make it average. You will make it average. You will find the mean value. You will perform some statistics. So you will represent here the average value of weight. Mean value of weight is this. This is the mean value. But actually the weight varies. You have got some minimum range, you will get a range. So for this, how much weight varied actually from the mean? So for that purpose, we use one statistics. We call it standard deviation. We call it standard deviation. So when we find mean value and find the standard deviation is given by plus minus sign. Means if you double the standard deviation value, for example, mean value is 5 and the standard deviation is 2, plus minus 2. Then from that you can derive the range. How? Plus 2. So mean plus 2 means 7 and 5 minus 2, 3. So 3 to 7 is the range. Sometimes standard deviation is doubled, then it is added to upper to find out the upper range and minus 2 SD for getting the lower range. So here what you will do, you will find your research data, you will produce statistics. But complicated studies, there are also complicated statistics. Don't use complicated statistics. Why? If all are research scholars, then you use. With complicated statistics, the others will not follow. Though you use a simpler one depending on your audience. So you have to research data for research data. First you have to, in your slide, you have to present what is your research topic, means heading. Then who is presenting it? You are presenting it. And from which institute you are? TSMC, Pune, which year? This year. So your identity will be there in the first slide. In the second slide, what you will do? You will, since it is a research study, you will make an introduction. In this introduction, you will say for this case, malnourishment is a problem not only globally, in India also. Particularly in developing countries, India is a developing country, so here it is also having a problem. Data regarding this undernourishment, malnourishment is available from other states, but I can see there is no data from Tripura, particularly from urban area. So this is the lacuna I got. So it is important to know this, because it is the duty of the government to look after the health of the public. That's why government has produced so many PSCs, centers, hospitals, because it is the responsibility of the government. Okay. So In that way, if your finding is alarming, then the government may take necessary action. So in that way, it is important. Otherwise, these children may die in future because of shortage of nutritious foods. So this is your introduction. This is your objectives. Okay. Then you have to, next part is the methodology, materials and methods. Means how you have, here you have to describe, you have to explain how you have conducted the research. So it is in PowerPoint, what you will do, you will not be writing in full sentence. For the first I did it, then I did it. So it will be very, the audience will become tired. So what you will do, keep just points. This point, then I will elaborate it. Second, this point, I will selection of subjects. How you have selected the subjects, you don't mention it here. You just tell your audience, I have selected the subjects like this. You have measured their height, weight, how you have measured weight, how you have measured, you just tell them. But it is right there the process, the main point. So in this way, remember one thing, in preparation of point, less is more. What does it mean? Less is more. How less can become more? Less is more. Means you provide less words and tell more out of this. Means you will be providing here less words, but from that word you will be explaining to others. Okay? So now let's see. Let's go through this. So we can, in PowerPoint presentation, we can use so many things to make you understand, make the audience understand what I am going to say. I want to transmit the information, transfer the information what I got. It may be a case study, it may be a research, it may be a theoretical subjects, whatever it is. So depending on that, I will prepare the slides. So I will give you some tips. So preparing a good PowerPoint presentation is a critical skill in medical education. Almost all teachers are using PowerPoint. Even whenever you will be presenting something, you will also be using PowerPoint. So it is very critical because so many things you have to produce. You are presenting a clinical case, no? So you have to, the patient image you have to give. De-identified. The face is not identifiable. And whether you are presenting research findings, case studies or lectures, mastering PowerPoint will help you convey information clearly and professionally. Because everything will present in an organized way, systematic way. Here we are using 1 hour lectures, okay, in undergraduate education, to impart knowledge. So in this context, so I am particularly interested in interaction. During my lecture, I want to interact with the students, and it is the essence of CBME. More the interactive session, more the interaction, you will be learning more. So you have to respond, you have to ask questions. So various advantages, you can use so many things, as I said, graphs, figures, animations, videos, different objects. So you can create so many things. different colors, different font, different sizes of fonts. So that's why it is very fun. And the medical students, it is a study from using medical students, uh, what they actually like. They like large text, large text, large fonts, and visual aids. In the presentation, there should be visual aids, pictures, animations, like that, and images, and this presentation should be available to you after the class. If you ask me, sir, I want a copy of this. So this is available. From them you can collect. So if uh, so, in my next class we will be getting the code of conducts of medical professionals. So you have to know all the conducts. Well, what is misconduct in this profession, and for which misconduct I may be punished. My registration may be cancelled. What activities will come under litigation? So you have to be very cautious about this. So PowerPoint presentation are a common tool in medical education for number of reasons. Quick communication, showing visuals, teaching, case studies, research data, easy to edit. Instantly you can edit. If something is wrong, instantly you can edit. I'll show you how to edit instantly. You just press the escape button, then this will editable one will come, and wherever it is, you just edit it. And the tips, the main part. Tips for making good presentation. Number one, understand your audience. See, the way I am presenting my data to you, my lecture to you, since you are a student, my tone, my way of delivery is different. But when there are professional, highly qualified professionals are there, so my tone will be changed, the way of talking will be changed, way of delivery will be changed. Okay, so you just check who is your audience. So depending on your audience, you tailor, customize how you will be presenting it to them. Okay? And the purpose we have discussed. So the goal determines the tone and content. What contents you will be producing? You are explaining function of this cell membrane. Okay. Very simple one. But when I will teach somebody by other to a planet population audience, the cell junctions and how these cell junctions are related to different diseases. So then then figures, everything will be complex. But if I produce these complex figures and explain this to you, then it will not be understandable to you. Then the structure, presentation structure, means the slides, first slide, second slide, third slide, how you will structure it. First slide should be the title. There should be title and who is presenting it and from which institute you belong. You may also put date. Nobody enters date. In the subtitle, so there is title where you will enter the title of your topic, and next is about the presenter. Then comes the introductory slide. At the first page of any book, what you will find? Contents. So in this slide, you can explain, you will be discussing this, or you can say after this session, I will be knowing this point, these and these points I will be knowing it. I will be able to explain it. Okay. Or if it is a research study, then you will write introduction, or there will be introduction, background, introduction, objectives, methodology, results, discussion, conclusions, list of references. So in that way you can enlist it in the second slide. Then comes the main contents. It is a vital part. This main contents will have mainly introduction, main content, maybe it may require number of slides. Numbers of slides it may require. But everything, all the slides are divided into introduction, body, where there will be main points, and the conclusion. Okay. For medical presentation, the contents include, so you will be presenting a case study. You will be presenting a case study. So what would be there in that presentation? The background means pathophysiology. History, a particular case you are presenting. So the pathophysiology of that disease and the relevant history. What history of the patient, what history he is providing to you. Then another slide you will present the clinical presentation, which will explain signs and symptoms. Then what will be the investigations, what investigations you made. Okay, there are blood investigations, X-ray or radiological investigation or any other investigation. From that only, from these investigations and from the signs symptoms, you came into diagnosis. So diagnostic part. So diagnosis, then you will provide the diagnosis. I diagnosed it as this since it is having, the patient is having this and this and this. Okay. Treatment and management. Then what to do? Then in the next slides, you have to produce plan of treatment. What are the treatments available? These. Now you will be suggested what protocols you will be following. So treatment, management, latest guidelines. What is the latest guidelines? There are guidelines. You cannot treat by you as you wish. No. So there are guidelines. So what are the guidelines available? What are the options available? Actually, we are not doing. Whenever you get a patient, go to a patient, and you have to communicate first. You have to try to know his or her problems. So communication first. Then you will be knowing what are complications. So for that purpose, you have to change yourself. So many things. You have to be patient. You have to listen carefully. You have to be a good listener. You have to be empathetic to the patient. So then only the patient will disclose. So I have such and such things. Then your plan is the procedure. So you have this, you have to explain, this has happened to you. Now I will treat you. These are the treatment options. You have to give the option. Which options you have to choose? You have to choose those options. And these options are, it is the right of the patient to choose the options. Because these are, here it is you. The option A has got this advantage, this disadvantage. This second one is this and this. Third one is this. Now you decide which option you want to. We are not providing these options. We are directly treating. But it is the right of the patient. I will discuss tomorrow. It is the right of the patient. Okay. So, then management, what management we have given and what the result you got. Finally, discussion. So here you will be discussing depending on discussion points, the audience will also ask you several questions. So you have to be prepared for answering those. What would be the probable questions from the audience. So you have to prepare yourself for answering those questions. Then comes the conclusion slide. Here you will summarize your all the findings. If it is research, I already discussed earlier, you have to produce the research findings, then what research title, author, institution, abstract. Abstract means the gist of the research findings. Introduction, background or rationale of the study, objective, purpose, materials and methods, results, tables, charts, images, discussion, conclusion, recommendation, references. So these are the topics included for research studies. For theory classes, I will not. You are already experienced. You are experiencing how these are made. So you know that, and this part is important. As I say, less is more. Just points. Just points. So at the right side, you will be giving, say, citing one image or structure. So at the left side, you will be using bullets. You will be using, say, these are bullets. It na pointer, advanced. These are bullets. So different kinds of bullets are there, main points. So here you will write the main points and you will explain. From that points you will explain. Summarize the complex data. As I said, research data. Summarize it. No need of all the individual data here, no need to produce, no need to give. And depending on your audience, medical jargons, what are the terms, lot of terms. I will be performing the patients of gastrointestinal disorders, they are here, and you are explaining why this is. So you will be explaining, I will perform cholecystectomy. So they may not understand what is cholecystectomy. So I will operate the gallbladder and take out the stones. So it is the simplest way. If you say I will do lithotripsy, so they may not understand. So there are so many difficult words the audience may not follow. So be cautious while using this type of words. So tomorrow I will be mentioning a person with integrity. What does it mean, integrity? A person is committed to excellence. What is excellence? If you don't know, I have committed for excellence. So what excellence? What do you mean by excellence? Then if you don't know it, then what commitment you will make? So I have to realize that. Incorporate visual design means there will be fonts, font colors, backgrounds. So so many things are available in PowerPoint. See, one after another, these slides are coming. This is called transition. You can use different kind of transition. Slide will be coming by floating or making a noise, exploding. So this will distract your audience. Never do it. Only you can use fade in, fade out. Simple one you use. Otherwise, your audience will be good, but they are distracted. And fonts, font colors, these are, do not use so big size fonts. And always, see, I have used white, background, black background and white background. Or you can use the reverse. And in a particular slide, you can use 7 to usually 5 to 8 lines, not more than this, though I have used more than that. Data, graphs, I will show you. Say you will be data you will be producing. Tabular data, as I said, we are not interested. Audience is not interested in tabular data. They are mostly interested in graphs. So when you will be showing some proportion. Say for example, I want to know out of 50 students, how many are girl students, how many are boy students. So I have to find out the percentage, and this you can show through a diagram called pie diagram. And when you will be comparing this blood sugar level was before the experiment and after the experiment, blood sugar level is this. So with this comparison, I can clearly understand after the treatment blood sugar level has fallen. So for comparative purpose, use bar diagram, or I can also use line diagram. When we use line diagram in 1970, population was there, this. In 80, population was this. In 90, this. What will happen in 1940, that I can predict. If I extend it, then I can, though I have not yet done it, project it. What would be the projected figure in future for person who is having 140 centimeter height, his weight is this. The person who is having 160 centimeter height, his weight is this. So in this way, you can extend. If you extend the length, what would be the expected weight of a person who is 190 or 180 centimeter in height? So in that way, you can project by using line diagram. ওই যে একটা ফেড আউট হয়ে গেল one for example so these will distract you. It came from the bottom, it may come from the right side, from the left side, or typewriter in this way it can come. So the way you choose, but don't use it. Engagement. While that I do actually, you have to engage the audience to make them attentive through interactions. So they can, then only you will be able to communicate what you wanted to do. Time management. This is very important. You have given a 15 minutes or 20 minutes slot, and you came with a large number of slides. What you will do to finish this? You will shift slides one after another very fast. You are in rush, so nobody will able to get anything. So you minimize your slides. Then what you can do? One patient, these are recorded. Stay on track means don't deviate. What you have planned to tell, be in the track. I usually go out of track. So I have a lot of time today, 2 hours time. That's why I am sometimes going beyond track. So don't rush, okay? And the practice. You have to practice before presentation. If you want to be a good presenter, and sometimes it is awarded in some conferences, best presenter, best orator. So if you want to be a scientist. There, good presenter. Then you have to present the lecture in a nice way. For which, within you have to finish all the points within stipulated time. So, what you have to do? You have to rehearse aloud. Where? In presence of your friends or in your hostel or at your house. So you rehearse it or before the mirror, facing the mirror. So you rehearse it. Then you will be able to present the lecture in a nice way. Get feedback. From whom? From your peers. They will suggest you miss this point, you add this point, it was too much, there was no need of this, so you rectify this and this. So then only you can rectify yourself. So this is feedback is needed. Lecture delivery tips. Eye contact. I make eye contact. Why? You cannot deviate. You cannot deviate. You will remain concentrated. See, you are, so what I am supposed to deliver, you have to get that points, so you will be able to get that points. Confidence. You have to know the subject very well. Then only you will speak with confidence. Otherwise, you will feel low. You will not be having so much confidence. You will, suppose somebody is having lack of knowledge what he is trying to tell. So then way of delivering will be different. There will not be confidence. Okay. So handling question, as I said, so there may be a lot of questions coming in the discussion period for every day after every delivery. So there is some 5 minutes discussion period. The audience may ask you several questions, so you have to prepare for those questions. You have used some terms which are not understandable to them. They may ask you, what is that? Why you have used this? So in that way you have to explain. Final thoughts. Keep your PowerPoint clear, concise and relevant. A good presentation does not just convey facts. It tells a story that your audience can follow and remember. Otherwise, it is useless. If you can't follow, they can't follow, useless. They can't remember, it is useless. So, you have to make the presentation in that manner. Because it is one of the very important quality of you. There should be this communication. With whom? With the patients. So you have to be a very good communicator. So this power of communication, the skill of communication, you have to attain. By following these guidelines, you will create a good, effective and professional presentation that leave a lasting impression on the audience. Okay? So these are the things you have to remember while you will be preparing a presentation. Now we are having half an hour time. We will go to computer lab. We will use PowerPoints, the basic things. How it is opened, what are the slides, how the image can be inserted, how picture can be inserted, how it can be deleted. So these are things we will learn.